Thanks for sticking around for Medical Monday. I'm joined right now by Dr. Saeed Affa. Thank you for joining me. Appreciate it.
Thank you very much.
And we're talking about breast augmentation surgery, which is much more common than maybe you would expect. You were giving me numbers before.
Absolutely.
Tell me a little bit about it.
It's one of the most common, actually, it is the most common surgical procedure which we performed over the past few years. For example, in 2008, more than 350,000 women they underwent only for breast augmentation with using implants. It's very common, and if you compare with 1997 till 2008, is more than 250% increase of this procedure overall.
So it's something that's a lot more likely scenario, I guess, for someone.
That's right.
Yeah.
Everybody thinks liposuction. No, liposuction is the second most common. The most common is breast augmentation.
Okay, so what do you need to know if you want to improve your appearance?
The choices I have, people, they lose weight after pregnancy, or pretty much sometimes they have the small size of the breast. The enhancing the breast requires replacing the volume. We have two choices. We can use their own tissue if they have enough tissue to reshape it. We call it breast lift.
Okay.
But if they don't have enough tissue or they lost it, the only choice is replace the volume with implants, as we see.
Which we have right in front of us here.
Absolutely. We have two kinds of implants, silicone and saline.
Okay.
They're both safe. The FDA took the silicone off of the market for almost 15, 16 years because they were not sure if it's causing any cancer or anything. They changed the quality. They did thousands of studies, and pretty much they found no issue, no cancer, no rheumatology
You were
disease.
telling me it was kind of neutral, right, to your body?
Absolutely. Silicone is neutral and is softer, and the feeling that the patient has is much better. And most of the plastic surgeons these days, their choices is going toward the placement of the silicone.
Okay.
As you see the picture here, we have placement of the implant is underneath the muscle or above the muscle. Each one has pros and cons. Underneath the muscle give the patient more secure placement because the muscle has blood supply, and actually it decreases the chance of infection. But it depends actually on what patient's anatomy look like, and during the consultation they can ask the surgeon the difference.
Yeah, and what happens during the surgery now?
The surgery, there are 3 steps. All the patients, they go under general anesthesia, and this picture actually shows to you that the patient has received the implant above the muscle.
Okay, I see.
And the second step, of course, incision. We have choice of incision. One of them is going to be underneath the breast, slightly above the fold. The other one would be around the areola, and there are some other technique, through the axillary line, through the belly button. It depends what patient choice is, and
all about preference then. And now another thing here, we're talking about, I guess, the silicone and it being safe.
Absolutely. If you can show the picture of the silicone, you can cut
it open.
Absolutely. Cut
Here we go.
Make sure you don't cut your finger.
No, I don't make sure I do that.
And pretty much it tells you that, as you see, they don't see that if you can lift it up, it's not like a motor oil. No, if you go back, it's going back to the shell again. Yeah, it's nothing that's leak all over. It's safe.
Yeah, as you can see, guys.
Absolutely.
It's just this.
It looks a little bit substance. Now let it go. See, it's going back. If you lift it up, see, it doesn't go anywhere. It stays right inside the shell. And if they have any rupture, pretty much sometimes they don't notice that. Of course, the saline, which includes the shell silicone, but the inside is like salt water. If they inflate it, the patient is going to say, well, I think one of my sides of the breast is smaller than that.
And that's what you're going to see then.
You replace it, there's no problem.
And then completely safe, though, if it does bust, right?
Absolutely.
Because it just goes with the body.
It's a salt water and they absorb it.
Okay. Dr. Aspa.
Sure. One thing about the recovery I would like to say, it's something that makes sure go 2-3 weeks, and just soreness, and should be fine. Okay,
sounds good. Thank you so much for joining me. Really appreciate it.
Thank you.
If you guys have any questions for Dr. Aspa, you can reach him at 30 Boyers Road, Harrisonburg, VA. Numbers there on your screen as well as the website. Before we go, let's take one look at the weather, and Viet has some gardening tips.